Canada's opioid crisis has hit an Ontario community particularly hard this month. Police in Peterborough responded to 19 drug overdoses in the first weekend of June, which resulted in 2 deaths. Thousands of opioid-related deaths have been reported in the last several years, 4,000 in the year 2017 alone across the country. So what now? Should Canada consider decriminalizing all drugs? Nathaniel Erskine-Smith is the Liberal MP for Beaches East York, and he joins me now. Hi, nice to see you again.
Nice to see you as well.
I appreciate it. We've had you on before to talk about this. You introduced a motion to your party's convention on the issue of decriminalization. I wanted to talk to you again because for the past few weeks we have been reporting on some really staggering statistics, including the fact that our life expectancy has been affected by these overdoses.
It is ridiculous to think that life expectancy in Canada is going down because of an opioid crisis. And actually it extends beyond. So the Health Committee's report speaks to methamphetamines, and I was just speaking to a friend from high school actually on Saturday, who a roommate of his at university, 3 of them tried cocaine on their couch and all 3 died because of an unsafe drug supply.
What are those statistics? And I know you're familiar, obviously, from what you say and what you've said in the past with the sort of severity of it, but what do those statistics tell you, and what do you think they should tell Canadians?
So 2 things. One, it's an incredibly serious crisis when thousands of Canadians are dying because of an unsafe drug supply, and addiction is part of that, but frankly, recreational users are dying because of an unsafe supply as well. And it's clear that we need to treat drug use as a health issue, and that's not me as politicians saying that. That is every health expert in the field who has studied this issue. And when you have such a serious issue and a clear policy response that is every expert has embraced, we really need to follow the evidence.
What would decriminalization of drugs do? Like, how would it work to help things?
So fundamentally, we should treat drug use as a health issue. And the problem with, and the Health Committee points this out, or the experts at the Health Committee certainly pointed this out. You have the Canadian Public Health Association say this is a major stigma associated with seeking treatment. And if you look at 2 countries that have adopted a health approach to drugs and moved into the health sphere from the criminal sphere, Portugal specifically saw a 60% increase in the number of people seeking treatment and an 80% reduction in overdose and drug-related deaths. The numbers are staggering. The successful numbers are staggering. So
what does this look like as a policy solution? Like, should this come from the federal government, and in what capacity? Yeah,
without question. So we know that BC health officials have said provinces can maybe take some steps to get closer to the answer. Fundamentally, it's got to be a partnership between federal and provincial governments. The federal government has to remove the possession offense. We're not talking trafficking, we're not talking production. Those will remain criminal offenses. We're talking people who are users, the very people we want to help and save. We need to make sure that they are getting into treatment, and we want to make sure that they are safe. And that means removing the criminal sanction so that they are willing to seek treatment, willing to talk about any drug use issues that they might have, and make sure that they get the help that they need.
The government, of which you're a part of, has so far resisted those calls pretty certainly. When we've interviewed the Minister of Health on this, she uses, for example, Portugal, and she says it's a different case. It's a smaller country. It wouldn't work the same way. What do you do about that? Why are they so opposed to it, do you think?
I've said before, I think the issue fundamentally is politics. So I'm heartened by the Health Committee's approach, which is to say, let's look at the Portugal model. Let's see if it can be positively applied, and let's undertake an evaluation to really get to where the evidence is in Portugal and maybe where the evidence could be in Canada. I think beyond politicians, when you look at the health experts themselves, they say politics be damned, this is a crisis, people are dying, and let's save lives by following the evidence and by treating drug use as a health issue. And I think as politicians, we have to do the right thing, not the easy thing. And I certainly, in the end, we have to be leaders on such an important issue, and even if it might be difficult politically, where the evidence is so clear and it is such a serious problem, we need to lead and explain and educate Canadians about the importance of such a policy.
Is the only mechanism available the Health Committee, though?
No. So as an individual member, it's an interesting timing, actually, because just today I got a draft of a piece of legislation I've been putting together to remove the criminal sanction for low-level possession under the Controlled Drugs and Substances Act. I think I'll be tabling that this week or next week at the first available opportunity. So I think it is about legislators, hopefully the government at some point, but putting these ideas forward and yes, undertake an evaluation of whether the Portugal model can be applied, but we already know that the #1 stigma associated with people seeking treatment is the criminal sanction. The health minister has already identified stigma as a serious issue. We're spending millions of dollars in educating Canadians and addressing stigma. This is the #1 stigma. Let's address that.
Have you talked to the health minister herself about this?
I have talked to the health minister herself, yes.
And last time you were on, you had some optimism that the prime minister or herself would change their minds.
Yeah, I don't think they are there yet, but in politics, sometimes advocacy takes a long time, and I've seen this in raising animal welfare issues early in Parliament. I didn't see success right away, but guess what? We just passed a bill to ban cetaceans in captivity. We're eliminating the trade in shark fins, and we have tackled animal abuse and animal fighting through a government bill. So continued and persistent and sustained advocacy, especially when grounded in the evidence, especially when there's such a serious crisis, I think we'll be successful in the end.
But if their political calculation is fear over what that word will signify to people who say, what do you mean you want to make drugs legal? Like, you know what I mean? The constituency of people who are who may not understand the possible effectiveness of such a policy.
Yeah, so then it's incumbent on me and other politicians. Terry Lake is hopefully going to be a colleague in the House shortly, but former health minister in BC who is keenly aware of this issue and is calling for decriminalization as well.
Works for a marijuana company right now, right? HEXO? Yeah.
Sure, yeah. But,
just to be fair.
Yeah, sure. But,
Liberal candidate, though, yeah. We've had him on lots.
But unrelated, different drug and different policy approach. It can be confused at times when people talk about drugs broadly. Cannabis was about, removing the criminal element and treating Canadians like responsible adults. This is about saving lives, and this should be even more important. And to your point about how do we move the needle, if it's a political problem because the public isn't there yet, then people like me and others in political positions and leadership positions need to be vocal and public in our support and educate Canadians. And I'll tell you, when I've had events in my riding and people have raised concerns and said, what do you mean by this? When I explain to them what it means, and I explain that it's about treating drug use as a health issue, treating patients as patients and not as criminals, and making sure people are able to get the help that they need if they need it, and to make sure we don't have thousands of Canadians dying, they want to help.
When you explain that to the health minister, what's her response?
Look, the health minister has been supportive of any number of steps that we haven't seen previous governments supportive of with respect to expanding harm reduction.
Yeah, I'm not trying to take away from what they've done so far. I know they've done safe injections and stuff, but they have been very hesitant to even entertain this idea.
Yeah, and I think people are afraid of the word decriminalization because, frankly, there's a misunderstanding. And even when I initially proposed this and wrote about this, the headline was Liberal MP calls to legalize all drugs. And so I think there are political concerns, frankly, about the level of understanding and the level of engagement we're going to get, and concerns, especially on the precipice of an election, whether this is a popular policy. But when you see such a crisis, should you be thinking about how popular the policy is or its effectiveness in saving lives?
All right, I'll leave it there. Thank you, Mr. Erskine-Smith. Nice to see you. I appreciate your time today.
Yeah, thank you.
That's Liberal MP Nathaniel Erskine-Smith. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video. Thanks for watching.